Swachh Bharat mission brought toilets to millions in Haryana. But while it solved one challenge, another was lurking just beneath the surface.
पहले हमें पता नहीं था कि सेफ्टी टैंक फुल हो जाने से उसे खाली करवाना पड़ता है।
In rural Haryana, 70% of households depend on single pits or septic tanks that must be emptied regularly. Without a safe system for desludging and treatment, this waste often ended up in fields, rivers, or open land. To ensure proper sanitation, fecal sludge should be collected, transported, and treated responsibly. With this goal in mind, the Government of Haryana, Public Health Engineering Department, and WASH Institute came together to build a complete, sustainable system for fecal sludge management. The challenge was the size of the problem. The solution? Co-treatment, where fecal sludge can be safely treated at existing sewage treatment plants, along with regular wastewater. By using what was already built, Haryana could manage fecal sludge across thousands of villages, quickly, safely, and cost-effectively. To turn co-treatment into action, the first step was mapping opportunities. WASH Institute identified villages needing desludging and matched them with nearby STPs. This information was shared with District SBMG and the Public Health Engineering Department. To make the best use of existing infrastructure, 120 STPs were carefully selected across Haryana for co-treatment. These plants were operating under capacity, making them ideal for handling additional fecal sludge. With the villages mapped and suitable STPs identified, the next crucial step was ensuring that the fecal sludge is safely collected from the villages and efficiently transported to the STPs. Thus, the success of this entire FSM system depended on one key group, the desludging operators.
पहले हमें मल टैंकर खाली करने के लिए कोई मैदान या कोई खेत या सड़क के किनारे या नाले में खाली करना पड़ता था.
They were key to making the system work, but unregulated practices, poor wages, and lack of recognition left the system exposed. Recognizing this, all the key players were brought together to build a system that's fair, transparent, and built for trust. To bring order and accountability, desludging operators were registered on a dedicated digital platform. This ensured that only licensed operators equipped with identity cards, trained in safety protocols, and following all environmental regulations could collect and transport fecal sludge. Operators were also required to maintain logbooks, use mechanical equipment, and wear PPE, making the entire process safer and more professional. The result? A system that not only protects public health and the environment, but also gives operators the dignity, recognition, and support they long lacked. The system was now live across Haryana. Let's see how it's working on the ground. It begins with a request. A household calls a toll-free number to book desludging. The request is logged and assigned to the nearest registered operator. A trained, registered desludging operator equipped with safety gear and a vacuum truck arrives and performs a hygienic sludge removal, preventing leaks, odors, and health risks. Every detail is logged: the time, location, and volume. The operator then follows a designated route to the nearest co-treatment facility, preventing spillage and environmental hazards. The journey is also monitored to ensure compliance and accountability. At the co-treatment facility, the sludge is unloaded into a designated area and undergoes a controlled treatment process where it is integrated with the existing sewage for further processing. Each step from collection to treatment is recorded and monitored. This is fecal sludge management in action: efficient, regulated, and working for people, for health, and for the environment. What began as a plan is now a functioning, impactful system transforming sanitation across Haryana. 10.8 crore rupees from SBMG funds were invested wisely and used to upgrade 120 existing STPs for co-treatment, based on WASH Institute's carefully made designs. Over 500 private desludging operators were identified and brought into the fold. Today, 281 operators are officially licensed, trained, recognized, and empowered. Fair pricing too was part of the solution, with district-level rates ranging from 500 to 1350 rupees per trip were decided through mutual agreement with operators. But beyond the numbers, it's the how that makes the impact. A smart use of existing resources led to faster, cost-effective impact. And the results? Cleaner villages, protected soil and water bodies, lower risk of disease, recovery of water, nutrients, and perhaps most important, community trust, built through a process that's transparent, fair, and built to last. Haryana has shown how fecal sludge management can be reimagined and at scale. A cleaner future isn't just possible, it's already in motion.